Shri Madhusudan Sai, born as Madhusudan Naidu in a middle-class family to noble and devoted parents Mrs. Padmavati and Mr. Maheshwar in Bilaspur, a small town in the state of Chhattisgarh in central India on July 26, 1979. As a child, he was described as intelligent. Fast forward from the year 2012, Shri Madhusudan Sai began working to expand his master's work in the areas of education, healthcare, nutrition, and social welfare programs absolutely free of cost, both in India and across the world. Now, India Abroad has connected with Shri Madhusudan Sai, talking about the three areas, the three fields his humanitarian work exists in, and what he expects of the Indian Diaspora, given his recent visit to San Francisco, and a lot that he has to tell.
News, views, voices of the global Indian community. India Abroad.
I represent a group of people back in India and many countries of the world, over 60 countries, who work towards the upliftment of the humanity, especially the marginalized sections of the society, the vulnerable sections like children, women, elderly. And we work in three major areas: in nutrition, education, and healthcare. These apart, livelihoods, environment, sustainability are other areas where also we are very active. But largely the major three areas are nutrition. As you understand, nutrition is one of the most important services that are needed, especially in a large country like India, where we feed close to around 20, across 25 states and 4 union territories. We feed approximately 10 million children a morning nutrition meal. This is called Sai Show. It is done through a project called Annapurna. And these are across 100,000 government schools, where we feed close to around 10 million children on a regular basis in the morning. So that is the first program of Annapurna, which has had a huge impact in terms of impacting the health outcomes, the academic outcomes, the enrollments in the school, as well as the growth and development of the children in these schools. So all the schools are mostly government schools with which we have partnerships. And that is the first project I would like to tell you about. The second one is about the education program. We have close to around 28 campuses in India and one in Nigeria, where over 3,500 students get totally free of cost residential education, all the way from schooling to PhD through our university. And we also have the world's first free of charge medical college in India, which started 2 years ago with the blessings, and the inauguration was by the Prime Minister, Honorable Prime Minister Mr. Modi, who came all the way to inaugurate and start the program. So all these education is provided absolutely free of charge to all the recipients. Most of the children come from below poverty line. 60% of them are girls, and all our campuses are situated in rural India, so that it's accessible, it's available. And of course, there's no question of affordability because everything is provided absolutely free of cost. The children have to just walk in with a pair of clothes on their body and they can go out with degrees. Not just that, we don't stop at education. We also employ these children after their graduation or post-graduation as teachers, as administrators, as managers in our own institutions. In the last 10 years, we have employed more than 200 of our own alumni who have passed from these educational institutions in our own colleges, hospitals, schools, and so on. And the third one that I want to talk about is the healthcare program. Again, India's healthcare system is largely urban-oriented. What I mean to say is that while 70% of India lives in the villages, they have access to less than 30% of the total healthcare infrastructure and doctors, whereas the 30% of urban India has access to 70+% of the total healthcare. So that is the kind of disparity that exists in India. And to solve that, we started off with multiple levels of healthcare programs, from screening and preventive healthcare all the way to tertiary healthcare. So we run 5 pediatric heart hospitals, which are exclusively for children, and they treat children with heart diseases at birth, which are called congenital heart diseases. And we do close to 30 plus interventions and surgeries every day, absolutely free of charge across these 5 centers. We also have a multi-specialty hospital at Bangalore, which is close to Bangalore airport. And this is also the teaching hospital for the medical college that we are running. These are 360 bedded facilities, which is expanding to another 600 beds or so in a year's time. and we'll add the postgraduate courses for various specialties as well. Again, all these services are free. We have impacted more than 2.2 million patients in the last 9-10 years, and we have done over 70,000 surgeries and interventions. We have done every day we see close to around 2,500 outpatients across these centers. So that's the kind of scale at which the healthcare mission goes on, and all this is absolutely free of charge. The patient can just walk in with his problem, will get diagnosed, will get treated, even operated, and after his recuperation, his discharge, the food, the accommodation, even for the family members who are attending to the patient is also provided on the campus absolutely free of charge. So these are the three major verticals where we work. And as you can understand, all the three are extremely important for the development of any country, especially a young country, a growing country like India. Yes, sure. We have a huge base of supporters who are based out of San Francisco and California region, Bay Area. These are the people who help us through the foundation that we have locally established called One World, One Family Foundation, which is 501c, and that helps us to kind of gather some support, especially from the non-resident Indians and expats who live here in this area, and they have been supporting the mission. So I've been coming quite often. In the last 10 years, I've been coming here almost twice a year, and I've been meeting with more people and making them aware of the work that we do, so that this also helps them to participate in any which ways that they deem fit. As you just heard, that most of these are based in rural areas. See, rural India itself has a certain set of challenges which we can imagine. They are not as connected or as equipped, as developed as the urban areas. And so developing a tertiary care hospital in a rural India comes with its own challenges to get the specialists to work in the rural areas, and also the education level of the rural patients, which also needs a lot of coaching, lot of educating, lot of awareness creation to help them understand how they have to take charge of their health. Even if you treat them and you send them after an operation, they have to look after themselves by taking medications, by taking care of them. So these are the challenges. In nutrition, as I said, again, reaching out nutrition to far away rural pockets of India, that too first thing in the morning at 7:30 a.m., again is a challenge, and that too doing it at a scale is definitely a challenge. So we have innovated. What we did is we came up with a multi-nutrient mix called Sai Sure. It's a ragi millet-based drink, and that is fortified with several nutrients which are required for the child's growth. So that is how we are able to do it at scale without having to struggle through the logistics of delivering it early in the morning. Similarly, the education program also sees a lot of challenges, especially with the rural girls. Most of the children, when they attain the age of 13 or 14, the parents want to withdraw them because they want them to work in the fields or in the shops or elsewhere. And when it comes to the girl child, it's even worse, because the girl children are thought of as mostly a liability in the family, and they are only thought of as somebody who needs to get married very soon, and the parents can be kind of free of that particular burden of looking after a girl child. So getting them educated, especially getting them enrolled into higher education institutions in rural area, is a huge challenge. So we had to work our way through the existing social structure without hurting the sentiments, at the same time convincing the rural parents that their girls should be educated even beyond 10th standard or 12th standard, because she has so much potential in her, she can do much more for them. So when we started the university, we educated a lot of girl children's parents and told them that if they leave the children with us to study the graduate or postgraduate program, they will start getting a stipend as well, along with the free education and the security of a campus. The girls will get a stipend which will go directly to the parents' account. This encouraged a lot of parents to leave the girls behind in institutions. And I told them that this money that they save over the 3 or 5 years, that would be helpful for the wedding expenses or anything else that they need to spend on the girl child later. This apart, the girl will also become self-sufficient. She will be independent. She can earn a living and support the family. So initially there was resistance to this idea. Not many believed in rural areas. But now, after several years of work, and they have seen the success of a lot of these girls who have become postgraduates now. They're doing PhD, some are lecturers, some have become good teachers and administrators and earning a good salary. The parents have become very happy, and they have become now our ambassadors who go around telling other parents that they should allow their girl children to get educated. So that's the success story of girls' education. And the biggest success is most of these children have stayed back in the rural area. There was no migration to the urban areas because we also created employment for them in our own institutions, which are situated in rural localities. So as I said, we already have 200 plus of our own students who are our employees. This apart, I think in coming times, over the next 10 years, we will be able to employ at least 2,000 of our own students. The same thing was done for medical college. Medical education is highly expensive. That is the reason why most of the people don't want to stay in rural area, because they can't earn back or the investment that they have made. So what we did is we made the medical education free. They come from the regular NEET, whatever the national exam. They are qualified. They come. We keep them with us. We train them for 2-3 years to pass the NEET exam, because most of the students study in vernacular languages and they have to write the exam in English language. So that's a huge obstacle for them. But we coach them for 2-3 years, then help them qualify, take them into our system. It's free. The only condition that we have put is that you should serve in the rural area for some number of years after your graduation. So that way we are able to kind of build capacities and also help the rural India get the right kind of specialists. So these are challenges, but I think we have found a way around all of them. And with the support of the society, the governments, and like-minded organizations, we have come a long way. Surely, I think the cooperation that we have received so far is, as you understand, if you have to establish any institution which is educational or healthcare related or even nutrition program, you need the permissions from the government to undertake these programs. You need the support of the entire ecosystem, right from the ministerial offices to the people at the ground level, grassroots level workers, ASHA workers, Anganwadi workers, to the teachers in the school, to the cooks and the other support staff. So we needed all their help. The government gave us the permissions, necessary permissions, and supported us that way. So that way we are very grateful that we could do things very fast because of the very smooth processes in the government, who appreciated the kind of work we do. The other thing that we also are working with government is to ensure that the existing programs that government has undertaken are implemented more effectively in the rural area. For example, the program like nutrition. Government has a scheme for nutrition, but most of the time the implementation is an issue. So we have partnered with some of the state governments to become their partner in implementing nutrition at the school level, where we share the budget. A part of it funding comes from the government based on their budgets and existing schemes, and the part of it we raise from the society, corporates, and other philanthropists, and that's how we complete the budget and implement these programs. We also train government school teachers in better skills. We also train ASHA workers and Anganwadi workers, the feet on street healthcare workers, for better outcomes of whatever they're doing. So that's a program that works alongside the government. I would say Indian diaspora, not just in the US, but everywhere around the world, has been very supportive. But there is so much more that can be done. I truly believe in that. We have been, as I said, coming to San Francisco Bay Area for the last 10 years at different points in time, met a lot of people. And most of these people who are supporting this are from Indian diaspora, but there are many others also who are not necessarily Indians, who have also taken to this cause. And I would not be surprised to say that they actually have taken it much more seriously and done a lot more for the country, India, which they don't even belong to. But just looking at the humanitarian cause, they have helped us in a big way. Maybe because they also are very interested in India's culture, what you said, the soft power, Indian spirituality, which is why they go about doing what they do. Indian diaspora has definitely supported this cause, but I definitely see a lot of scope for most of the people to come together and further these causes. And we are in constantly touch and talking to many of these people and many organizations in the area to work together for some of these causes back in India. I think the vision is very commendable. Nobody, no other prime minister, no other leader had a vision like this, where he thought that India could be a developed nation. And then putting a timeline and a target date is definitely very courageous and bold. We truly believe in that vision, and we want to support that vision in every possible way. My vision of a developed India, beyond whatever trillions of dollars of economy, beyond GDP of $10,000 per capita. My idea of India is an India where every child is in school, everybody is fed, nobody is unsheltered, and every girl child has the opportunity to get educated, stand on her own legs, and anybody who falls sick should have access to good quality healthcare affordably. Nobody, as Indian ethos says, Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu Ma Kaschid Dukham Apnuyat. May all be happy, may all be healthy, may all do good everywhere, may no one have any sorrow. That is my idea of a developed nation beyond the economics of it.